At a community health fair, the blood pressure of a 62 years old client is 160/90. The client states that my blood pressure is usually much lower. The nurse should tell the client to number 1. Go get a blood pressure check within the next 48 to 72 hours. Check blood pressure again in 2 months. See the healthcare provider immediately. Visit the healthcare provider within 1 week for a BP check. And the correct answer is go to get a blood pressure check within the next 48 to 72 hours. Why? Rational is the blood pressure reading is moderately high with the need to have it rechecked in a few days. The client states that it is usually much lower, thus a concern exists for complications such as stroke. However, immediate check by the provider of care is not warranted. Waiting 2 months or week for follow-up is too long. The home health nurse visits a male client to provide wound care and finds the client lethargic and confused. His wife states he fell down the stairs 2 hours ago. The nurse should number 1. Place a call to the client's healthcare provider for instruction. Number 2. Send him to the emergency room for evaluation. Number 3. Reassure the client's wife that the symptoms are transient. Number 4. Instruct the client's wife to call the doctor if his symptoms become worse. And the correct answer is send him to the emergency room for evaluation. Why? Because the clients require immediate evaluation. A delay in the treatment could result in further deterioration and harm. Home care nurse must prioritize interventions based on assessment findings that are in the client's best interest. What would the nurse expect to see while assessing the growth of children during their school age years? Number 1. Decreasing amount of body fat and muscle mass, little changes in body appearance from years to years, progressive height increase of 4 inches each year, yearly weight gain of about 5.5 pounds per year. And the correct answer is yearly weight gain of about 5.5 pounds per year. Why? School-age children gain about 5.5 pounds each year and increase about 2 inches in height. This is the correct answer. Which of the following should the nurse implement to prepare a client for a KUB, radiography test, KUB, kidney, ureter, bladder? Number 1. Client must be NPU before the examination. Number 2. Enema to be administered prior to the examination. Number 3. Medicate client with Lasix 20 mg IV prior to the examination. Number 4. No special orders are necessary for the examination. You all must write the correct answer in the comment section below. I will not tell what is the correct answer of this. Okay. When teaching a client with coronary artery disease about nutrition, the nurse should emphasize number 1. Eating 3 balanced meals per day. Number 2. Adding complex carbohydrates. Number 3. Avoiding very heavy meals. Number 4. Limiting sodium to 7 grams per day. And the correct answer is number 3. Avoiding very heavy meals. Why? Because eating large heavy meals can pull blood away from the heart for digestion, and it is dangerous for the client with coronary artery disease. The nurse is performing a neurological assessment on a client post-CVA. Which finding, if observed by the nurse, would warrant immediate attention? Number 1. A decrease in the level of consciousness. Number 2. Loss of bladder control. Number 3. Altered sensation to stimuli. Number 4. Emotional ability. And the correct answer is a decrease in the level of consciousness. Why? Because a further decrease in the level of consciousness would be indicative of a further progression of the CVA, cerebrovascular accident. A child who ingested 15 maximum strength acetaminophen tablets 45 minutes ago is seen in the emergency department. Which of the following orders the nurse do first? Gastric lavage, acetylcysteine for an edge per pharmacy, start an IV dextrose with 0.33% normal saline to keep vein open, activated charcoal per pharmacy. The correct answer is gastric lavage. Removing as much of the drug is the first step in treatment for this drug overdose. This is the best done by gastric lavage. Which complication of cardiac catheterization should the nurse monitor for in the initial 24 hours after the procedure? Number 1. Angina at rest, thrombus formation, dizziness, falling blood pressure. The correct answer is thrombus formation. The thrombus formation in the coronary arteries is a potential problem in the initial 24 hours after cardiac catheterization. A client is admitted to the emergency room with renal calculi and is complaining of moderate to severe flank pain and nausea. यहाँ पर note down कर ले pain. The client's temperature is 100. The priority nursing goal for this patient is maintain fluid and electrolyte balance. Number 2, control nausea. Number 3, manage pain. Number 4, prevent urinary tract infection. And the correct answer is manage pain. The immediate goal of therapy is to alleviate the client's pain. Pain is the priority. A nurse prepares to care for a 4-year-old newly admitted rhabdomyosarcoma. The nurse should alert the staff to pay more attention to the function of which area of the body? Sarcoma. Okay, number 1, all striated muscle. Number 2, the cerebellum. Number 3, the kidneys. Number 4, the leg bones. And the correct answer is all striated muscles. Because rhabdomyosarcoma is the most common children's soft tissue sarcoma. It originates in skeletal muscle and can be found anywhere in the body. A client has been newly diagnosed with hypothyroidism and will take levothyroxine 50 microgram per day by mouth. As part of the teaching plan, the nurse emphasized that this medication, number 1, should be taken in the morning. Number 2, may decrease the client's energy level. Number 3, must be stored in a dark container. Number 4, will decrease the client's heart rate. And the correct answer is should be taken in the morning. Why? Because thyroid supplements should be taken in the morning to minimize the side effects of insomnia. The nurse anticipates that for a family who practice Chinese medication, the priority goal would be number 1, achieve harmony. Number 2, maintain a balance of energy. Number 3, respect life. Number 4, restore yin and yang. And the correct answer is restore yin and yang. Why? Because for followers of Chinese medicine, health is maintained through balance between the force of yin and yang. In children suspected to have a diagnosis of diabetes, which of the following complaints would be most likely to promote parents to take their school-age children for evaluation? School-age children. Number 1, polyphagia, dehydration, bedwetting, weight loss. And the correct answer is number 3, bedwetting. Why? Because in children, fatigue and bedwetting are the chief complaints that prompts parents to take their child for evaluation. A client comes to the clinic for the treatment of recurrent pelvic inflammatory disease. The nurse recognizes that this condition most frequently follows which type of infection? Inflammatory diseases. Number 1, trichomoniasis, chlamydia, staphylococcus, streptococcus. And the correct answer is number 2, chlamydia. Why? Because chlamydial infections are one of the most frequent cause of salpingitis or pelvic inflammatory diseases. A child who has recently been diagnosed with cystic fibrosis is in a pediatric clinic where a nurse is performing an assessment. Which later finding of the disease would the nurse not expect to see at the time? Number 1, positive sweat test, bulky greasy stool, moist productive cough, meconium ileus. The correct answer is moist productive cough. Noisy respiration and a dry non-productive cough are commonly the first of the respiratory signs appear in a newly diagnosed client with cystic fibrosis.